Today, I'm going to be showing you how to take a 7-site skin fold measurement. Skin fold measuring test measures the amount of subcutaneous fat that is proportional to the total amount of body fat. Skin fold assessments of the body composition is dependent on the expertise of the technician and other factors that can contribute to error, like poor technique, experience, an overly obese or lean subject, an improper calibrated caliper, or a plus or minus 3.5% accuracy. These are some pictures of the calipers that may be used. When using a caliper placed directly on the skin surface, 1 centimeter away from your finger and thumb, make sure it's halfway between the fold and crest, and maintain the pinch during the reading. Read the caliper within a second and no longer, taking duplicate measurements, and when doing so, rotate through measurements to allow the skin to go back to normal thickness and texture. The caliper that I'm using is already calibrated, as you can see. The following figures show the 7 measuring sites for men and women. Make sure the subject is relaxed and that you are measuring on the right side of the body. I will be marking the 7 sites first to help locate the skin fold site. The tricep measuring site is on the posterior midline of the upper arm, halfway between the acromion and olecranon processes, with the arm held freely to the side of the body. Next is the subscapular fold. If you cannot locate the scapula, have the person bring their arm behind their back so that the scapula is noticeable. This will be a 1 to 2 centimeter away from the angle of the scapula. The chest area for women is about 1/3 the distance between the anterior axillary line and the nipple, and for men, half the distance. On this measurement, I actually marked it as a woman. It should have been done where the arrow indicates. The mid-axillary fold is located at level with the kyphoid process of the sternum. Next is the suprailiac fold, which is in line with the natural angle of the iliac crest, taken in the anterior axillary line immediately superior to the iliac crest. The abdominal fold is about 2 centimeters to the right side of the umbilicus. The 7th site is the thigh, which is on the anterior midline of the thigh, midway between the proximal border of the patella and the inguinal crease, which is the hip. I will now be taking the skin fold measurements. The tricep is a vertical fold. Make sure you pull the skin to separate it from the muscle. Take the measurement and write it down. The subscapular is a diagonal fold. The chest is also a diagonal fold. Make sure you hold the pinch and take the measurement. The mid-axillary is a vertical fold. Make sure you pull away to just get the skin. The suprailiac is a diagonal fold. The abdominal is a vertical fold. And the thigh is a vertical fold. Make sure the subject has all their weight on their left leg to be able to get a good measurement. This is a chart that I have created to help with the measurements. It takes about 2 trials to get an accurate reading. Make sure you rotate the measurements to allow skin to go back to normal thickness and texture. Female and male equations are listed below to calculate bone density for the subject. The bone density will then be used to calculate percent fat, which I have listed two equations that you can use.